Welcome back to part 2 of disorders of the nervous system. We're going to start out talking about strokes, or what's referred to as vascular disorders. A stroke is the sudden death of brain cells due to a lack of oxygen. And this can be caused by blockage of blood flow or rupture of an artery to the brain. So either way, there's not enough oxygen getting to the brain cells. Now we will talk about this, but rupture of the artery can cause other damage besides just hypoxia. Symptoms: sudden loss of speech, weakness, paralysis on one side of the body. So you see these act fast things, and what this is this is telling you the different symptoms of a stroke. So the F for fast would be face. So ask the person to smile, does one side of the face droop? A for arms, ask the person to raise both arms, does one arm drift downward? S for speech, ask the person to repeat a simple sentence. Are the words slurred, and can the person repeat the sentence correctly? And then T is time. If the person shows any of these symptoms, you need to call 911 fast and get the person in, because brain cells are dying, and the sooner the person can be treated, the better off they're going to be in the end. So one of the things is a transient ischemic attack, which is also referred to sometimes as a mini stroke. So a clot can form in a blood vessel in the brain, so there's not as much oxygen going to that part of the brain, but then the clot just dissolves and the brain flow comes back and oxygen is back and everything is okay again. So symptoms come and symptoms go. And one of the things about transient ischemic attacks is people can kind of just ignore it. They don't even know sometimes that these things are happening to them. But even if the patient has symptoms, they should go to the hospital anyway, because the problem is this could eventually lead to a full-blown stroke. Because if they're getting clotting in the brain, then as you can see here on the right side, you have death of the brain matter. And this is not a good thing at all. You can also have what's called focal cerebral ischemia, and this is due to obstruction of blood flow. So for instance, you might have an emboli, and this is going to cause the hemorrhage looking area in the brain, and this hemorrhagic infarct is kind of reddish brownish color when you look at the brain itself. And these emboli typically arise from the heart. And then you have what's called ischemic infarct, and this is due to a thrombus, and it gives you this more pale whitish color in the brain. And this can arise from atherosclerotic plaque. So a lot of times the transient ischemic attacks are often going to tell you that this worse stroke type of situation can occur. So just so that you know, a thrombus versus an embolus. A thrombus is a blood clot that forms in a vessel. An embolus is anything that moves through the blood vessel until it reaches a vessel that it's too small to pass through. So you might have this thrombus, which is your blood clot, and then a piece might come off of that and it travels through the blood. And then when it gets stuck somewhere, we've got a thrombus again. So you can see the more red color. Now really it's more of a reddish brown in the brain, and so this shows you where the death has occurred. Even though you have bleeding here, you have death in a much wider area. Now one of the things that happens is when a blood vessel breaks on the brain, it not only stops oxygen, but it's releasing things like glutamate and other chemicals that come from the blood, and these chemicals can damage the brain and cause the brain cells, neurons, neuroglial cells, and so on to die. So this is a recent hemorrhagic infarct. So can you tell where it's at? Do you see it on the right side or on the left side? And if you're looking right here, you can see definitely on this side right here. And you have this sort of brownish color that has occurred because of the bleeding on the brain. This is an old infarct, and you can see where this is what the blood does when it touches the brain, and then you can also see it over here as well. So this person must have had multiple strokes. The blood literally dissolves brain matter. Treatment will not work after the first few hours of a stroke, and this is why it's so important that you get the person to the hospital right away. And it's also very important that the triage nurse knows what a stroke is and the treatments of stroke, because it's unthinkable to leave this stroke patient sitting out in the waiting room for 5, 6, 20 hours waiting for treatment, because that whole time brain matter is being destroyed. And so we have too much tissue damage. Now, one of the treatments that can be used for a stroke patient is TPA, or tissue plasminogen activator. And what this is like a blood thinner, and it helps to dissolve that clot. There's also what's called a thrombectomy, which means that you go in and you actually remove the clot from the brain. So risk factors of having a stroke would be hypertension, smoking. Now, of course, if a person stops smoking, the risk factor from smoking will disappear about 2 to 4 years after they quit, which is really good. Diabetes is also a big risk factor as well, because we know that sugar damages blood vessels. Cholesterol building up like a plaque in the artery can also narrow those blood vessels, and that is that interaction between sugar and the fats creating that damage. Now you have also what's called global cerebral ischemia, and this is due to hypotension, so low blood pressure instead of high. And the outcome depends on how bad that hypotension is. So you can have mild to severe problems from this. Mild, the person might have transient confusion, don't really know where they're at for a while, but everything kind of comes back again, and that's when really blood pressure goes back up again. Then blood is flowing and everything is okay. Severe, they could have so much brain damage that basically they're brain dead, and so they're in a persistent vegetative state. And this is global ischemia, so you can see how whitish the brain looks, and what's happened is those brain cells aren't getting enough oxygen, and so they're dying off, and you really can't tell very much between gray matter and white matter in this brain. All right, so we're going to talk about skull fractures. And the first type we're going to refer to is a simple or linear fracture. And this is just a basic break in the bone, kind of looks like a line. So you can see here you've got linear fractures going on. And then right here you have a linear fracture. Here, coming down here, another linear fracture. You also have a comminuted fracture, which is the bone is splintered or crushed in a number of places. Now, this is probably the original force, the blunt force to the brain. Looks to me like it could have been a hammer to the brain, I don't know, or maybe the person fell, or maybe was in a car accident. And so what happens is there's a lot of force in this area here, and this creates a circular fracture. And then you have multiple fractures from the increased pressure that compression of the brain causes, or the vault cavity causes. Then you have these cracks that go out from there. You also have a depressed skull fracture, and again, this is a very pretty hammer to the skull, and it is where bone fragments are then embedded in brain tissue. Another is called a displaced, which is similar to the depressed fracture. And then this can also occur from falling. So for instance, a lot of times when somebody falls when they're awake, then we typically see this type of fracture in the occipital lobe area. And if they fall due to a lack of consciousness, a lot of times they're going to fall forward, and this is going to cause a frontal fracture. You can also have basal skull fractures, and these are really unique. Typically, it requires a lot of force to get a basilar or a basal skull fracture, and then it can affect cranial nerves, it can affect the orbits or the mastoid region, and hematomas can form along with cerebrospinal fluid drainage. And so the basal skull fracture is a break of a bone in the base of the skull. And a lot of times, like I said, you'll get bruising behind the ears, bruising around the eyes. As a matter of fact, it kind of looks like little raccoon circles of bruising around the eyes. Blood behind the eardrum, and then even cerebrospinal fluid can leak out of the nose or the ears. And so you can see here, you see a fracture here in the base of the skull. And then you can have fractures temporal region and then down here in the base. And more fractures in the base of the skull. And then this shows you the bleeding behind the ears. And then due to multiple kinds of injuries, including fractures, you can have a concussion. And the definition of a concussion is altered consciousness from head injury due to change in momentum of the head. And so the head can be hit, or the head can hit a rigid surface, and there's going to be issues with the brain. Mechanism unknown how this concussion occurs, but symptoms can be amnesia, confusion, headaches, visual disturbances, nausea, vomiting, dizziness. Now, when we grade a concussion, this tells us how bad a concussion is. And there's a lot of different ways to grade this, but basically, number one, no loss of consciousness, or it lasts for less than 15 minutes. Number two, you have some loss of consciousness, and it lasts for more than 15 minutes. Number three, you have loss of consciousness, and the person will take a long time, if ever, to regain consciousness. Post-concussive neuropsychiatric syndrome, this exists, and this is a lot of times due to traumatic brain injury because of repetitive injuries to the brain. These are just some other ways, and you can see there's multiple different guidelines that can be used in order to grade concussions. So, direct parenchymal injury, we talk about contusions and lacerations. A contusion is bruising. Laceration is tearing of tissue. So you can have contusions to the brain. You can have lacerations to the brain as well. So here you see this bleeding on the brain, and so this is our bruising. Anywhere we have bleeding, this is bruising that has occurred. And remember, anytime blood interacts directly with brain matter, there's going to be destruction of that brain matter. Blood should be flowing through blood vessels in the brain, and blood should never directly touch brain tissue. So contusions or bruises are permanent in the brain, and bruises of the cortical surface of the brain can occur, and that bruise causes necrosis of the tissues, which those microglial cells come in and they phagocytize all that tissue away, and you get holes in the brain. Astrocytes can then form scars, And axons can be broken or stretched due to what we call shearing force, and we'll talk about that in a little bit. So cerebral contusions, they're similar to subdural hematomas because they can result from displacement of the brain. So the brain, if you could open the cranial vault of a living person, what you would see is you'd see the brain covered by all of that dura. And we're going to talk about that in just a second. Underneath of that dura is fluid that allows our brain to basically float in this kind of shower curtain type of material surrounding it. The brain is not super glued into the skull so that it's immovable. The brain actually kind of wiggles around and floats around, and the brain is kind of the consistency of Jell-O right before the Jell-O is super hard, okay? So it's a little bit on the liquidy side. And so the brain, if we're moving our head back and forth, side to side or front to back really fast, the brain can actually hit that cranial vault, and there can be contusions that occur. So when the head is moving and the head strikes an object or an object strikes the head, this can cause contusions. Now, you can have what's called a coup and a contrecoup type of blow to the brain. So a coup type of blow means that there is impact of the brain onto the skull bones, and the brain impacts on just one side. A contrecoup is where the brain kind of rebounds and impacts on the opposite side. So you can have a coup, that's the first impact, and then you can have a contrecoup, which is the second impact. So we talked about the brain floats freely in that cerebral spinal fluid, and then blunt force trauma can occur so that something hits the head or the head hits something. And we have acceleration of our brain within the skull, and then what happens is all of a sudden the brain hits that skull bone and the brain decelerates rapidly, and that force is transmitted through the brain tissue. So a coup is a direct contusion of the brain at the site of that first external force, and then the contrecoup is the opposite side of the brain then being injured. So if we strike this fixed object, the brain is going to impact the front of the skull here, and we have a coup. When the head moves back, the skull hits backward, and we have a contrecoup. And this just shows you the force, and you have contusion here. If the force is here, you would have the contusion here. But if you have the first force here, then the brain goes backwards, hits the second force back here. That's the contrecoup. Now, these are little petechiae, little tiny hemorrhages in the brain that has occurred. This is a very large hemorrhage, and this is a coup type of hemorrhage. And you can see here, this is the coup, and notice here, here's our contrecoup. So this is our first large contusion, and then our second. Now this is going to be a coup contrecoup, but it's a little bit different. The coup is here, the contrecoup is over here on the side. So the head hit first here and then rebounded to the side. Now notice, let's go back to this picture here, all the blood. Okay, this is fresh. Here, this is older. And so what's happened is you have the blood breaking down, and we have some hemosiderin building up in here. You have destruction of some of the brain matter, but this shows you this is an old contusion. And you have a coup right in here, and notice destruction of that brain tissue, and then there doesn't appear to be a contrecoup. This is a really nice picture also because it shows you all the teeny tiny blood vessels, and the larger blood vessels that the blood should be running through. And you have a coup, and then you have here and here a contrecoup. And again, little petechial hemorrhages here, and then larger hemorrhaging right here. And you can see this is all the blood on the underside of the brain. Now that post-concussion syndrome we talked about, so concussion refers to an immediate and transient loss of consciousness accompanied by a brief period of amnesia after a blow to the head. Recovery usually takes place in about 24 hours. Now this depends on how bad the blow to the head is. Some people don't ever recover certain parts of their memory because of the blow. Mild symptoms may persist for months, like headache, irritability, insomnia, poor concentration and memory, or even years. Diffuse axonal injury. This is injury in the axons located in the deep white matter of the brain. And remember, we talked about twisting or shearing of the axons. Shearing means pulling, okay? So imagine grabbing a hold of an axon and just pulling it apart with both hands. So this can be caused by angular acceleration, and that means that the head is moving back and forth very quickly or from side to side quickly. Think about the problems with shaken baby syndrome, where you have this little baby and somebody's shaking them very, very hard, and their head is moving back and forth super duper fast. And the common cause of coma is going to occur because of this diffuse axonal injury, okay? So let's say that you have a person who has been in a really severe car accident, and maybe their car has hit a tree at high speed. And so what happens is they're going 80 miles an hour and they bash into this tree. Their head, their body is moving forward at 80 miles an hour, and when they hit that tree, everything stops. And so because the head is on this small neck, it flings forward very quickly and then flings backward very quickly. And this creates that pulling or shearing of the axons, causing trauma and potentially coma in the person. And this is just showing you the twisting that can occur because of trauma. And then that twisting can result in permanent death of your neurons in your brain cells, and they cause that post-traumatic condition or traumatic brain injury. And this shows you, okay, so we have some petechiae in here, and this is from traumatic brain injury, but you also see in here all of these axons that have been pulled on. You should not be able to see that. See, a little bit normal over here. That's still a little bit off here. Much more normal looking here, but you can see where axons have definitely been pulled, twisted, sheared. Traumatic vascular injury. So you have things like an epidural hemorrhage, a subdural hemorrhage, and a subarachnoid hemorrhage. Before we go through each of these, let's just kind of review the different layers that we have covering the brain with these meninges, okay? So you're looking at the skull bone, and then you're looking at the thickest layer, which is the dura or the dura mater, which means tough mother. Now, between the skull bone and the dura, you can see there is a little bit of a space, and this is called the epidural space. Between the dura and the next layer, which is the arachnoid, there is a space here which is called the subdural space. And then you have the arachnoid. Now, underneath the arachnoid, there is another space called the subarachnoid space, And then after that, you have the pia mater, which is directly attached to the brain. And if you tried to peel the pia mater off, you'd peel chunks of brain matter off too. The arachnoid has all of the blood vessels going on with it as well. So again, you have the skull, and this is just a little cartoon looking at the brain, and attached to the brain is the pia mater, and then you have the arachnoid. So underneath the arachnoid is the subarachnoid space, and then from the arachnoid you have the dura mater, and then you have the skull. So between the dura mater and the arachnoid is the subdural space, and between the dura and the bone is the epidural space, okay? So these are all important because we're going to talk about hematomas that can form due to trauma and how they can affect the brain. And again, this is just another picture of the dura mater and how thick it is. And then on top of the brain here is the arachnoid. And the arachnoid can be peeled off. Unlike the pia mater, you can't really peel that off. So again, epidural hemorrhage, this is going to be above the dura, so between the skull and the dura mater, and that means any blood that is forming isn't going to press directly onto the brain because the dura is making sure it doesn't get to the brain. Subdural hemorrhage or subdural hematoma, this is blood between the dura in that subdural space and the arachnoid, and a lot of times this is due to shearing of bridging veins. So these are the veins that attach the dura to the arachnoid. And then you have subarachnoid hemorrhages, and this is blood in the subarachnoid space. Usually this is due to contusions of the brain or a ruptured berry aneurysm, which we're going to go over. And typically, if a subarachnoid hematoma forms, the person is not going to survive. So epidural hematoma, accumulation of blood between the skull bone and the dura mater, usually results from a blow to the head, and that can result from a fracture, especially we're talking about temporal lobe fractures or temporal bone fractures. Generally fatal unless treated. Now, that's because even though that blood doesn't touch the brain directly, if that epidural hematoma gets too large, it starts to create pressure on the brain, and that pressure, as we've talked about before, it can cause herniation of the brain, or it can just cause trauma to the brain in that neurons die, and you aren't going to survive that. So this is the epidural hematoma, so scalp, skull, and then this is the dura mater, and you have bleeding in this space right here. So you have the epidural bleeding. If you have the dura mater here and you have bleeding underneath of the dura mater, you have a subdural hematoma, and then this is the arachnoid right here. With these epidural hematomas, initially the person is asymptomatic. 30 to 50 milliliters of blood in this epidural space can start to cause symptoms, and you may even have some hypoxia or cerebral ischemia going on, and then you might develop what's called a Cushing reflex, and this is a protective response that augments cerebral circulation and it increases cerebral oxygenation. So the heart slows. This increases ventricular filling, and myocardial contraction becomes more forceful so that circulation can occur. Here's showing you an epidural hematoma. So this is after the brain has been removed. This is prior to the brain being removed, and this is the dura mater here. So you have this bleeding between the skull and the dura mater. And you can see another little hematoma here, another one here and here. Probably some kind of car accident. Another epidural hematoma. So you have some kind of skull fracture, it ruptures here, and this epidural hematoma creates pressure, which then causes pressure within the brain, and you can see that herniation that occurs could even cause hemorrhage within the brain stem. There's another hernia right here. This is the dura mater here. Here's the skull bone, and then you have an epidural hematoma. And again, dura mater, and this is above the dura mater, so we have an epidural hematoma. Transtentorial herniations is where the hematoma is compressing against the midbrain, and that displaces the brain down through the tentorium by the cerebellum, and you have that herniation. Pupils on the side of the hernia are generally fixed and dilated, and the herniation compresses vasculature, and it can create venous stagnation. So again, here you go here. Here's the herniation that is occurring. So there's the cerebellum, and it's pushing into here. And you can see here, another big hernia bleeding here. And here's the herniation here. Actually, I lied. There's the herniation right there. And you can see nice and clearly, this is the herniation right here. This is bleeding into the brainstem, the pons, and the midbrain from that type of herniation. Epidural hematomas are progressive, and when they aren't taken care of, can be fatal within the first day or two. And of course, we said this is from some kind of blow to the head. And it doesn't necessarily create a concussion or coma or anything like that. Subdural hematoma, this is an accumulation of blood in the subdural space, and that's because of the tearing of those bridging vessels. Significant cause of death after head trauma, and this can be from a fall, some kind of assault, somebody hit somebody in the head, vehicular accidents, sporting injuries, and it develops in areas between the dura and the the arachnoid. So this is in the subdural space. And these are the bridging vessels from the dura mater up here, and then this is the arachnoid, and you can see here, these are all bridging vessels, and they tear due to this trauma. And so this is the dura mater, and this is the hematoma, and you can see what kind of damage it does to the brain. So subdural hematomas, you have the cerebral hemispheres impacted, and this is usually the occipital and the frontal bones that are going to cause the issue. And soft cerebral tissue is also impacted, and so what happens is the brain again is either hit or can hit these bones, and then it recoils and you get that shearing. So what happens is those vessels get pulled on and then they rip. So symptoms of a subdural hematoma, you have headache, contralateral weakness, seizures can occur, and it can impair cognition and eventually can lead to dementia. So again, just showing you cartoon-wise a hematoma and the pressure it creates on the brain. And this is a subdural hematoma. Another huge subdural hematoma. A subarachnoid hemorrhage. This is bleeding into the subarachnoid space, and it may be associated with traumatic head injury. Usually there are other things that can occur as well, such as an aneurysm, and so you have bleeding into this part of the brain. 2/3 of subarachnoid hemorrhages reflect the rupture of this arterial aneurysm. So this is the rupture of an aneurysm, and this is what we call a baryaneurysm, which is an aneurysm that occurs at the base of the brain in what's referred to as the circle of Willis. And typically, people are not going to survive a subarachnoid hemorrhage. And the reason being is because that epidural or subdural hemorrhage doesn't necessarily mean that blood is going to touch the brain. The pressure from the blood may cause issues with the brain, but the person can survive this. The blood touching the brain is what's going to cause destruction. And again, this is another baryaneurysm, and so you have bleeding into that subarachnoid space. We also have traumatic intracerebral hematomas, and they result from either a non-penetrating or a penetrating trauma to the head. They may be single or multiple and can occur in any lobe of the brain. Most often you're going to see them in the frontal or temporal lobes. Now, data have shown that traumatic intracerebral hemorrhages often expand over time. So that means the hemorrhage is going to get larger with time, and this can be very damaging and life-threatening. So here's a really traumatic intracerebral hemorrhage due to gunshot wound. And obviously this person isn't going to survive this. So all of this is the trauma, and you have all this bleeding within the brain, and you have this area that the bullet has traveled through. This is another region for bleeding that has occurred, and again, this is another traumatic brain injury, and this is due to another type of gunshot wound. Another gunshot wound. These are all in different regions of the brain, causing different types of injuries and death. Now, what you see here is you see blood vessels that are inappropriate, and usually this is due to some kind of trauma, and these blood vessels can rupture. Now, this is a more fresh trauma. See how red this is here? This is new bleeding, where the others were more brown. So you didn't get to that trauma immediately, couldn't see that more red color to it. All right, so let's talk about those cerebral aneurysms. These are developmental defects. Now, what I mean by that is an aneurysm runs in families. This is genetic. And you have to be very careful and be aware of this. So we'll talk about baryaneurysms, and then we'll talk about atherosclerosis and hypertension with aneurysms, and then also bacterial infections that can cause mycotic aneurysms. Trauma can also cause what's called a dissecting aneurysm. So symptoms are often abrupt. Weakness is the number one symptom, and then death can occur. So this is showing you an aneurysm that occurred and the trauma that happened to the brain. Another aneurysm, and then the bleeding on the brain. This is in the cerebellum. So cerebral aneurysms are due to some type of vascular anomaly, and so what happens is the side of the blood vessel is weak, and so if a person has hypertension, then that high blood pressure can push onto the wall of that artery and cause that artery to balloon out. And eventually the wall becomes so weak that the artery explodes. And this can lead to stroke, or the old-fashioned term was an apoplexy. This can occur anywhere, such as in the basal ganglia, the pons, the cerebellum, the brain stem. You can also have what's called a Charcot-Bouchard aneurysm, and this is where you have lipohyalinosis, and this is due to long-standing hypertension. And so you get deposits of fat and hyaline-like material into the walls of the arteries, and those walls break down. So this is the thrombus that has occurred, and so this is where the artery is supposed to be, but that artery has ballooned out, and you can see it here. This is the ballooning out due to that thrombus that has occurred. Now sometimes it's just simply due to the wall of the artery being weak, or sometimes it's due to a thrombus that's occurred in there, and that high pressure then weakens the wall of the artery. So here's just a picture of an aneurysm, and what you see is the wall of this artery has broken down and it's not as strong as it should be, so blood is pushing in there. And of course I think you can see how hypertension can make this much, much worse, and eventually the aneurysm can explode. Now, just so that you know, aneurysms can be anywhere. They can be in the brain, they can be in the aorta, they can be throughout the body. And baryaneurysms, this is an embryonic defect in the artery. So the artery has congenital muscular weakness, and more than 90% of these types of aneurysms where a sac kind of bulges out occurs where the carotid arteries or some kind of artery is going to branch. So rupture of a baryaneurysm results in that life-threatening subarachnoid hemorrhage, and 35% mortality during the original hemorrhage. And so you can see here, this is our circle of Willis, right? And these are the areas most likely to have aneurysms, okay, the most common sites for a baryaneurysm. And this is a baryaneurysm, obviously, that has not burst yet, but has caused a massive amount of pressure on the brain stem, and that pressure in and of itself was not consistent with life, and the person died from this. So with baryaneurysms, the person can have a severe headache, and sometimes for days, and not even knowing where this headache comes from, and eventually the person loses consciousness and ends up going into a coma and can die from this. And the sac, of course, like I said, can compress on the brainstem, compress on cranial nerves. It can even produce like palsy type of shaking and actions. And then here's a smaller baryaneurysm that did rupture. And then this is a person who had multiple baryaneurysms in that circle of Willis. An atherosclerotic aneurysm is secondary to atherosclerosis, and it's localized in the major cerebral vessels like the vertebral arteries, basilar arteries, internal carotid arteries, and the vessel elongates, okay, as the aneurysm enlarges, and this is called fusiform. It's rarely going to rupture, but the pressure can cause problems, and then there's complications because of thrombosis. Mycotic aneurysms arise from infection in the arterial walls, and this can produce a septic emboli, and bacteria proliferates, it induces inflammation, the aneurysm can rupture. And so you can see right here a really nice scan showing you the aneurysm. All right, so that is all we have for today. And I don't know if you can hear my bloodhounds howling, but they're having a good time. So see you again next time. Bye.